Hello, my dear friends. Welcome back to my video on how to stop the overconsumption of healthcare. Actually, why I'm talking this topic? See, this is very important topic because whenever we talk about the society, the mainly we focus on healthcare. See, it is having a more priority than all other problems actually. The problem is here. See, overconsumption of healthcare is happening because of that overconsumption of healthcare by some people. Somebody who really require the treatment at the right time, they're not able to get the treatment, so they're losing their lives. See, my problem is very simple. Yeah, my problem is somebody doing wastage of resources. That means treatments or tests or healthcare services, but somebody are really indeed are in need are not getting, so they're losing their lives because of that. It's a really problem where actually as students, where actually as a educators or as a students, we should stand in this type of problems. This is what I just wanted to convey. Because of that, I come up with a presentation PPT. See what is all happening. I will show the proof also, how much is overconsumption happening, what is the problems with the overconsumption. See, and after that we talk about the solutions actually. See, you may be the top in one of the in building an applications to solve the problem, like integrating the technology. Somebody have a good mathematics skills where you can develop the model. This is what very important, where we should put our knowledge to the means we should apply our skills to such type of problems. These are very important, man, because when it comes to the healthcare, no, the priority changes, man. I'll tell you why, bro. Because see, for example, your friend asking 50,000 rupees, you will not able to give a 50 paisa also. But the same person got with accident, got with a any health issue, you will definitely give 50,000 immediately at any cost. That's what healthcare, health society is. That we really, that time humanity comes into the picture, where actually when they need, we are going to help them. Okay, humanity is mainly focused on actually healthcare, where the healthcare is facing so much problem. So my dear friends, please think about this. Okay, just give awareness. We just go with this topic, what is and all we should discuss and all. We'll go with that. Okay, we'll go deeply into my topic called how to stop the overconsumption of healthcare. Let's go. Just talk about the introduction first of all. See, what is overconsumption? Using the unnecessary treatments, medical services, tests or treatments if they really not required also. Because of them the overconsumption is happening. Somebody who really required, they're not able to get that. Okay, they're not able to get the medical treatments in urgency. They're not able to get that because of them, because all the resources are utilizing by the unnecessary people who are really not required, man. This is a problem actually. Next, we see, this is what means I just given a hello buddy, who am I. That means these are the myths where the bloody human society people are thinking actually. See, I'll really get so much of a smile when we talk about this poor man, because this is a myth where the people are thinking that like it's a true, like more treatment equals better care. Oh man, really? No, the better care, that means better care happens with the right treatment, not the more treatment. The people always think, oh, if for example a doctor says 12 days is a discharge period where you can go and take the rest in the home, but what the people will think, if there still more 3 days or 4 days, we'll get a better care so that we will get a better health. So it's not really, man, it's not really required. Please educate the people. If your surrounding people are like that, you should educate them, you should give awareness. As a student, you should give awareness, my dear friend. Okay, and let's go to the extra test. See what is happening with the extra test, see, for example, I tell you a knee injury or like a small, like a finger, like a hand, any problem, we can have the assessment through, means we can have what's the problem with the x-ray. But somebody people will go to the MRI also, means periodically, that too so many times in a year. That's not actually really required extra test. See, because of them, somebody who really required that test are not able to get that. Okay, and third point is, if it's recovered, why not use it? See, this is a point when it really comes when we talk about the insurance. See, I'll tell you, for example, 10 lakh is the insurance period. Sorry, 10 lakh is the insurance policy. When somebody are paying monthly, like 400 500, for example I'm saying. Somebody actually who really need with that medical treatment, they are using necessarily what they really require for what insurance. But somebody who really not require, somebody where the test, simple test can give a solution, but they are going with a luxurious and a very expensive test where they're utilizing overconsumption, means utilizing more money of insurance. What the insurance people will do, they will increase the policy money, means they will increase premium for those people who are utilizing properly, those who are not utilizing properly. For both them, they will increase the premium, so that what happens, a fair person who is utilizing properly, they will also affected by these peoples. See, wherever you talk, the problem of overconsumption of the peoples only. And fourth point is expensive tests are often preferred. See, this is a humanity, man. Sorry, human people mentality where it comes actually, because they think that the luxury is what the standard of life, like that expensive test means a better analysis, better diagnosis. It's not really. If you really that test is required for your treatment, okay. If it's not required, you can go with a simple treatment, but also going with a expensive test where it's actually not required, that's what overconsumption. The third point and fourth point is very important, where the people think just if it's covered in the insurance, then why can't we can go with that also, no? They think that really not required. If you want, you can go, man. Please, for these 4 points are the myths where you should actually get the knowledge, and where you should tell, give awareness to your friends, surrounding friends, okay? And what happens with the overconsumption of consequences of overconsumption? See, going with the unnecessary medications, so many times the side effects is happening. So many side effects. Increase the radiations exposure means, so the damage of tissues is happening. Because why? Excessive scans periodically, yearly, so many times going for MRI. That's what really not, if it's not necessary also. It's what happens because of exposure to the radiation so many times, that tissue damage will happen. That's what also side effect. Increase national healthcare expenditure. This is what I just want to do a presentation because of this point only. I just wanted to convey this thing, okay, my opinion, because a government, my government, means our government, Indian government is spending so much of budget in the healthcare sector, but because of these type of people who are utilizing the unnecessarily healthcare, the healthcare expenditure is increasing. Okay, increasing. Like for example, take the government hospital. If you not really require the MRI scanning, but also you're going with a MRI scanning without an X-ray, do you really require? What is happening here? You are utilizing the government property, means national healthcare expenditure is increasing year by year. The so much budget is increasing year by year. That's really should not happen actually. Okay, I'll tell you what should be done in a later slides. Higher insurance premiums for individuals and businesses. Why I actually explained this in a previous slide. See, because of if it's covered, why can't we use that mentality people? Because of them, what's happening, the premium is increasing for the both the uh, fair person and unfair person. So it should not happen like that. Okay, let's go with the next slide. Reduce healthcare overconsumption. See, how can we reduce the healthcare overconsumption? This is a very interesting, yeah. So educate the doctors on avoiding unnecessary tests. See, after reading this point, you should not go directly and tell the doctors, please, you should not give extra test. Really, he will scold like anything. Because why? We in our society, doctors have a greatest position, where we really have given a greatest position, where we can't give educate the doctors, but something should doctors should know, where the government should take the initiative, should run some campaigns to aware to provide awareness to the doctors. See, why I'm saying this is doctors have some fear, man. Why? I'll tell you, okay? Because they have some legal issues. They should not fall on that legal issues. Because of that, they will put so many extra tests, okay, for the safer side. But actually, it should not happen like that. And educate the patients on when medical attention is truly necessary. Yeah, first of all, okay, doctors we can educate, but the normal people will be there, no, like me and like you, we people will not take others decisions, means other suggestions actually. We can't tell them, we can't give awareness to the patients first of all. They will tell, why can't this test, doctor, write another test? That much courage is there for the patients. But the mainly really, we should do education. We should give education. We should give some awareness to the patients. What happens if you do, if you if you use the resources rigorously, unnecessarily, and everything consequences, we should explain to them, and promote self-care and preventive health measures like exercise and nutrition. Why can't, see, I really say the government to take some initiative on this, okay? Use celebrities for this, just to promote the standard of living, like what to eat, and what is the nutrition process they should go, and what is the healthcare measure they should take, and everything. Well, sometimes for some promotion, some like they can give at least advertisements. Only commercial side we should not see always. Some humanity, some factors would be there where they should focus on that. Next is strengthen regulations on excessive diagnostic testing. See, this is a very important point actually, because government should provide a proper policies for the testing, for the diagnostic testings, okay? Where the really proper policies and rules are very important when you're going for a test, okay? So that we can decrease the duplication of tests and leveraging technology wisely. See, whenever we talk about the technology is a one thing where the improvement happens. Integration of technology is very important when we face some problems in a society. I really, I suggest that a blockchain is a technology where we can integrate to the healthcare system. This problem, my solution to this problem is blockchain technology. Somebody will be knowing what is blockchain technology. Somebody may not be able to know. You'll be getting, okay. See, blockchain technology is one of the booming technology. You'll definitely getting to know in a future days if you don't know. Where we can have the patient's data recorded permanently. I mean, the way all the doctors can see that data, so that what happens, they'll be getting what actually previous tests have gone, what is output, and everything. Patients' details they'll be getting. This is my solution to the these problems. Your solution may vary. You can give some applications like that. You can give some models where it can be correct. Okay. Well, see, this is the point where we should stand actually. We students should stand in this type of problems. And next is, do I really need the test or medication? Where we and you should really think about this. Yeah, if you need the test, you go with that. Otherwise, please, yeah, don't go, because of you somebody are not getting. Yeah. Next, you see, this is one of the campaign where in a US has happened. I just wanted to show you some proof, because see, they given some awareness to the doctors and physicians what you should do, what you should not do. Like, these are the three principles I just wanted to give. There are multiple principles of this campaign. See, these are the example I just wanted to explain. So three principles I have given, where see, like for example, don't do imaging for low back pain within the first 6 weeks unless red flags are present. That means what, somebody doctors, what they'll do directly, they'll go with a go with a test and all, where it actually is not required for a few initial days. Just for, you can keep it with the observations and everything, but they'll not do, they'll directly go with our test. So it's what our consumption like this. There are so many awareness where the doctor should get. Well, such type of campaign should run in India too. I just if I am a CM or PM, I would have gone through this. Okay, this way the government should do some procedures. It means some initiatives they should take in this type of things. Well, they are doing, still more required, because the increment in the overconsumption is increasing so much very rapidly. See, this is one of the journal, okay, where the researchers has gone through non-government organization and government organization, so many health cases, health hospitals. They have taken the data and represented. This is a one of the journal where, see, the antibiotic consumption is increased 22% from 2008 to 2016. That means you can think that, see, there is a population increment. I can say that there is an increment in antibiotic consumption also. But see, there will be some limit, man. Increment happens with some limit, but increment without a limit, like 22% sudden increase, it's not a normal consumption, it's a overconsumption. See, just antibiotic, I'm saying there may be in multiple overconsumption in so many drugs is happening. This should not happen actually. Okay, healthcare society So many things are happening in our consumption manner. It should not happen actually. It's not my problem is. Conclusion is very simple, buddy. Very, very simple. You please do educate your friends, or somebody people will be there surrounded by you. They are following some myths like more treatment, more better. You tell them right treatment is right, more better care, not the more treatment is more better. Okay, right treatment is very very necessary. As students we should do something on this, just integrate the technologies, just develop an application like create a models and something, do something, yeah, or whatever you'll be getting an idea, do something. Thank you so much my dear friends, and finally please educate your surrounding peoples. Somebody who don't know actually what happens with the consequence of overconsumption of healthcare, where we as students should actually stand up. Thank you so much my dear friends, thank you one and all.